everyone, thank you for being back today. Today's video will be about infant dental care. Last time we spoke about the pregnancy dental care, and today we are discussing once the baby is born, what do we do? Once our baby is born, what are the correct steps to help them have optimal oral health? A lot of parents do not know that the first dental visit is recommended by the first 12 months or by the time that the first tooth erupts. Usually that's about 7 or 8 months, so it's very, very soon. The reason to take your child to the dentist this early is because you want to get them familiar with going. It can be very intimidating or scary to patients. All of the noises, the people, the assistants, everybody there, and taking your child as early as possible will definitely help for later down the road to have a better experience. Taking your child early to the dentist is crucial in helping prevent early childhood caries, which is extremely common in children, unfortunately. Home care is one of the biggest factors. Oral hygiene, trying to get the child familiar with cleaning their teeth. It is important to try to clean your child's teeth in the morning and at night. Nighttime brushing is the most important because your child has been eating, drinking all throughout the day, and you don't want your child to go to bed with that bacteria built up from the day while they're sleeping. Even if your child's first tooth has not erupted, it is still important to help clean their gum tissue. A lot of the time, they're drinking their bottle, their formula, their milk, and film develops on the gums. So it is important to grab a little washcloth, a soft washcloth, clean one, and use that to clean the gums. This helps them to get familiar to cleaning their mouth, cleaning their teeth, and it doesn't freak them out. Once the first tooth has erupted, then you use a child-sized toothbrush, which is a very tiny one, or there's one that you could put on your finger, and you can go in there and clean around the first tooth, the first couple of teeth, and it helps them, again, to be familiar and getting used to you cleaning their teeth. It is also important to try to use an infant-safe fluoride toothpaste. The fluoride will help remineralize the teeth and prevent those cavities that we were talking about. Once the teeth have erupted, usually again about 6, 7, 8 months depending on the child, watch out for a chalky appearance, off-white appearance to the teeth. Usually the baby teeth are very bright white color. So if there's an off-white kind of appearance to the teeth, or there's little marks or little areas, to let your dentist know. Usually this spot, it's a demineralization area, can be more prone to cavities. And a lot of the time, if the mom during pregnancy has had complications, the baby teeth can erupt with these different enamel irregularities. Another important factor to consider is using fluoridated water. Fluoride, again, will help to minimize the risk of cavities for your child. The American Dental Association supports the use of fluoridated water with your child's formula. One of the most common factors in causing cavities is use of the bottle when going to bed. This happens, obviously the child drinks their bottle, is put to bed, but it is important to try when they're going to sleep to only put water into the bottle. The reason is when the milk or the formula stays on the tooth surface, it can cause demineralization of the teeth, the sugars that are produced by the bacteria. So this again can put your child at a high cavity risk. Also, it is important to not add sweetened milk, juice, soda, or sugary beverages into your child's sippy cup or bottle. It's important to only give them water because these sugars, again, are going to contribute to cavities. And you wouldn't believe how many children come to the offices 2 or 3 years old with cavities all over their teeth. It is also important to encourage the use of a regular cup by the age of 1. I know this can be challenging, or even a sippy cup, because you want to get them used to not using the bottle. The American Academy of Pediatrics recommends children being weaned off the bottle by the age of 18 months. Another big factor is thumb sucking and use of a pacifier beyond the first 12 months can contribute to deformation of the palate or shifting of the teeth, which later, if not corrected by itself, can only be done so by orthodontic treatments or braces. You want to make sure to discourage the use of their thumb and encourage the times that they're not sucking their thumb. Now, many parents also also say, well, you know, these baby teeth are gonna fall out. What's the point of taking care of them? This, unfortunately, is not the way to go about it. The teeth are there in order to help your child to eat, to function. If the baby teeth end up having problems, your child could be in pain. They could have an infection. And these teeth are also present to help preserve space for adult teeth to erupt. If your child loses a little molar, a little tooth before the appropriate time, it could cause the teeth that are standing next to each other to shift in, close in that space that will later be used by their permanent tooth. I know this was a lot of information, but hopefully it was helpful to you. If you have any questions, please write them down below or send me a message. Thank you for sticking around till the end, and I'll see you all in the next one.